I'm here today to ask you to give FASD, Fetal Alcohol Spectrum Disorders, a seat at the table. I work for FASD United, the national organization that supports individuals with fetal alcohol spectrum disorders. I hope you leave today with something you know about FASD, something you can feel about people with FASD, and action items to do. So FASD United has been around for about 30 years, actually coming up on 35 years, formerly as the national organization on fetal alcohol spectrum disorders. I come to FASD through a boy named Nathan. I was my son Nathan's fifth mom by the time he was 5 years old. We adopted Nathan through the foster care system, and his behaviors were seen as so big that he had gone through 5 different foster homes. Imagine that. That breaks my heart. I am so grateful I get to be this little boy's mom, and at the same time, what trauma that caused him going through those different homes. And what we found out later was that those behaviors weren't a result of poor parenting. They weren't a result of him being a naughty kid. They weren't a result of trauma. The result of a disability that we weren't adequately accommodating. We weren't. So knowing that, we actually ended up adopting 2 other children with FASD. So FASD is an umbrella term that we use for a number caused by prenatal exposure to alcohol. It is a spectrum disorder, similar to autism spectrum disorder, where support needs vary based on the individual. If you've met one person with an FASD, that's it. You've met one person with an FASD. They all have different strengths, they all have different support needs and different challenges. But there are a number of different terms under that umbrella, and none of them are necessarily more severe than the other. Just different support needs. Why do I want you to give FASD a seat at the table? Because it's prevalent. Awareness of FASD does not match the prevalence. A recent case ascertainment survey used active case ascertainment, meaning they went out and diagnosed in 4 representative, and they looked at first graders. And in those first graders, they found 1 in 20. 1 in 20. Let that sink in. Who grows up to be a person aging who may need care in our communities. What was even more fascinating than that was that this entire cohort of thousands of kids with FASD, only 2 had a previous diagnosis. Those numbers did not include youth in the child welfare system and youth who were adopted. Those are some pretty staggering numbers if you take into account that autism has a prevalence rate of 1 in 34. We also know that drinking during pregnancy is an issue. We know that 1 in 7 pregnant people consume alcohol during pregnancy. That number is actually, and we know that there was a 41% increase in binge drinking among women of childbearing age. So, what are our kindergartners going to look like? How many Nathans are we going to see unsupported in our systems to give FASD a seat at the table and have conversations around fetal alcohol spectrum disorders wherever disability is discussed? A lot of people will think, well, that's simple. We know how to fix this, right? Just don't drink while you're pregnant. It's easy. Problem solved. And we know that there's information out there. You know, the Surgeon General's advisories, there's warning labels on the back of alcohol bottles. We know this. But what we don't know and what we don't hear is that there's no safe time, no safe amount, no safe type. And even from some of our medical physicians, we hear that, oh, a drink here or there isn't going to hurt you. It's not going to hurt your developing child. I know that when I was going through rounds of in vitro, I was told a glass of wine was okay here and there. So when you're speaking in the medical space, I encourage you to give FASD a seat at the table and have these conversations. So we simplified this. We said it's easy. Just don't drink while you're pregnant, right? Looking at this chart, most pregnant people don't find the sixth and the eighth week. Look at all the things that are developing in that time span. The central nervous system, the face, right? FASD is going to happen wherever there. We're not saying there can't be alcohol. We tried prohibition once, it didn't take, right? We're not saying that. What we're saying is that people need to be aware of what alcohol can do. For example, you can see that there's an area where the teeth are developing, the palate's developing. One of my kiddos was born with a cleft palate. That was a result of the prenatal exposure. So it's not as simple as just saying, it's okay, just don't drink while you're pregnant. We also know that there are people with substance use disorders, with alcohol use disorders, and they may not have the ability to stop drinking or the ability to stop drinking with safety. So what if we instead focused on the people living with this highly prevalent disability? What if we focused on them living their best lives in community, fully supported? What might that do to this equation? Because we've been trying the prevention thing for years. We've been telling people don't drink while you're pregnant. We know drinking rates during pregnancy have gone up. We know rates of people with FASD have gone up. What if we flipped that narrative and focused on the we know that many places about FASD because people are worried about having the stigma. They're worried about telling somebody that they might be a bad mom because they drank during pregnancy. Thousands of birth parents of people with FASD. None of that. We know that FASD is seen more often and more commonly in child welfare community at rates of 25%. Um, how can we support families who might be in crisis, families who might need more care in having those healthy pregnancies? So this is why FASD needs a seat at the child welfare table. We need to be talking about this in the child welfare space. Again, that little boy, Nathan, 5 moms in 5 years. Had any of those foster parents had training in how to support a child with FASD, in how to recognize a child with FASD? Think of the cost to that little boy, and then think of the cost to the child welfare system. Let's give FASD a seat at the table in the child welfare space. But there's a lot of prejudice around FASD. There's a lot of assumptions, a lot of bias, and a lot of stigma around FASD. I can tell you that through CDC data, we know that if you picture in your mind what a mom who drinks during pregnancy looks like, she looks like me. She looks like a middle income, that is the most common user of alcohol during pregnancy. But that's not always seen, and that's not what's screened for. Maternal child health, when we're talking about pregnancies and healthy pregnancies, we also need FASD to have a seat at the table through consistent universal screening. We need to be asking the questions. How far along are you in your pregnancy? When did you stop drinking alcohol? Are you aware of what alcohol can do? These are the questions we need to be asking by giving that seat at the table. And again, how we talk about this really matters. It matters that we talk about this as in FASDs happen when a developing fetus is exposed to alcohol, not when women drink. not by pointing the finger at women and pointing the finger at pregnant people. In many states in our nation, there are actually punitive policies against women if they divulge that they drank during pregnancy. Their children are subject to being taken away by why on earth would you say, hey, yeah, I think I might have had a couple glasses during pregnancy, or I might have drank during pregnancy before I knew I was pregnant, and gets this for your kid if you know there's a chance of child welfare taking your child away. Important nuances that we need to look at, we need to think about when we're building policy. We need to, by making sure that we make it easier to have these conversations about substance use during pregnancy so that the family can get the help that they want and so that the child who has an accurate diagnosis and supports and services that can help them. So if we look at through the lifespan, FASD, these are some of the things that you might see. Issues with feeding. One of my children was born with a cleft palate. There were definitely issues with feeding. There were issues with any dairy products. They couldn't have traditional formula. Sleeping. One of my 3 with FASD didn't sleep through the night till she was 7. Now imagine if I were a single person, a single parent, or I was a person in recovery, how that might impact my ability to remain in recovery with a lack of sleep. FASD needs a seat at the table. Going into childhood, school gets nowhere in special education and in training for special education are resources, accommodations, are those even covered? I have yet to go in one of the 3 of my kids and have a special educator how to support people with FASD. They have some awesome resources to support people with ADHD, awesome. But FASD, where conversations around education are happening to give FASD a seat at the table. Moving into adolescence, individuals with FASD have a really hard time connecting cause and effect. The part of their brain that controls cause and effect, thinking actual consequences, doesn't always connect. For example, at one point, my son he was in high school, and Mom, I can't go to school today. I have a headache. I just can't go. Now, I'm a mean mom. So, of course, I said, honey, grab a handful of Tylenol and head out the door. What I forgot is that my son takes things very literally. My son does not read the nuance. So, my son grabbed a handful of Tylenol, threw it in a Ziploc bag, and went to school. My son is a person of color. My son went to school, pulled out that bag of Tylenol. Immediately, the school resource officer was called. You can see how things could escalate, and individuals with FASD start having experiences with law enforcement starting at age 12, often through no fault of their own. As a matter of fact, people with FASD are more likely to be victimized by perpetrators of crime than causing the crimes themselves. They can be very naive because they don't put together that cause and effect thinking. Going into adulthood, people with FASD often age at different rates. Issues with their hearts, with their lungs that weren't screened for before, um, issues with those developments, they aren't caught. And then they start having issues and medical issues way earlier than their peers. So FASD needs a place in our justice system. We need to be having conversations. As a matter of fact, the American Bar Association passed a resolution back in 2012 stating that FASD needs to be included and considered in many cases. So FASD needs a seat in the justice table. FASD really needs a seat at the mental health table. 94% of people with an FASD will develop co-occurring mental health concerns in their lifetime. All 3 of my children started experiencing suicidal ideation starting at age 12. Suicide rates are incredibly high amongst our population. Good news. There's things we can do. Having an accurate diagnosis really, really helps. When my son went in and finally got his diagnosis at age 10, and yes, it took us 5 years to get him diagnosed, and he has fetal alcohol syndrome, which is the one most physicians know about. He's got the facial features that people associate with fetal alcohol syndrome. He started crying and he said, "Mom, this means my brain is different. It means I'm not a bad kid." Right? There are interventions and supports for families, for parents to be able to set things up so that our kids can be supported in community, so they grow into adults that can become Rotarians, that can change the world, that can have happy, healthy, successful lives. But we know that it starts with a diagnosis. So, diagnosis, universal screening, that needs a seat at the table. So, I've encouraged you to give FASD a seat at the table in all of these systems. People with FASD are capable of amazing and wonderful things. So I talked to you about my son, Nathan. Nathan's now 22. Nathan graduated high school during the pandemic on the honor roll. Nathan is going to university right now to become a social worker to help other kids like him. Nathan has held down a full-time job since he graduated from high school and has saved up enough money to put a down payment on a house. Nathan's going to be just fine. He's going to need some help and support. He's working on getting his driver's license. Memory issues are a big consideration for people with FASD, and he's worried that he might forget the rules of the road. He's worried what he might do if he gets pulled over. So he's taking his time learning it, right? But he's going to be okay because we as parents got that diagnosis and we were able to get supports on how to support him properly. It starts with that diagnostic piece. One of the big things that happens in disability is that often we try and fix people. We try and have them fit our mold. And one of the great things that we were able to learn in supporting Nathan and in supporting our other children is that you can spend all your time, effort, and energy in trying to fix the things that are hard for them and have them work on the things that are difficult for them. But if you put that same time, effort, and energy into the things they are truly good at, they could be great. Spending all the time focusing on the negative things and the hard things, they might get a little bit better. But if you spend that same time, effort, and energy on the things they do well, they can be amazing. And research and evidence has shown that within our population. So the way you support people with FASD, really, 2 of my daughters are incredible artists. They might struggle with other things, but we focus on their art. My son has a compassion for others that is unparalleled. We focus on that. So focusing on the strengths is really the way to go for people with FASD, and quite honestly, for most people with disability. So I hope I've left you with here's what FASD is. It's a spectrum disorder. It's not just fetal alcohol syndrome. It's not just recognizable by facial features. It's a continuum of medical disabilities that can be diagnosed that are based on prenatal exposure to alcohol. I hope I've given you the urgency, the need to talk about FASD. And I really hope I've given you the seat at the table where those conversations need to happen. So I'll open the floor to question our table. Thank you.
Particularly since I have a daughter with a disability, I totally support your message of diagnosis, education, support, education, and compassion. I do have a question on questions. Prohibition, after all, passed for a reason, and it was difficult to pass. Constitutional amendments don't come easy. But what if alcohol were treated as the new cigarettes, given that it is a dangerous and addictive substance that not only can result in fetal alcohol syndrome, but also rape, auto accidents, assault, murder? Maybe we should just reframe our societal attitude toward alcohol. What do you think? I'm not talking about interdiction prohibition. I'm talking about change in societal attitudes, the way we change our attitude about cigarettes. Cigarettes were romanticized in the 40s and 50s. Everybody had a cigarette. And now they're stigmatized. And maybe rather than prohibiting alcohol, we should stigmatize it. That's the question.
I think that's such a great point. Absolutely. And I think, one of the things we see is alcohol being marketed more and more to women. We see food deserts where there's more alcohol stores than there are grocery stores. So I agree with you. And there is a huge sober movement happening where alcohol at functions is being replaced by mocktails. It's being replaced by other substances. So I agree with you. Yes. And there's a lot of and conversations that happen with FASD. And, alcohol is not good for our bodies. We know this. So I agree.
Thank you so much for your very prepared presentation today. In part, coming to you with a YMCA perspective of a variety of programs and services from Youth and Family Services, focused mostly in Montgomery County, to additional programs around the region. It's getting my brain thinking about how it may impact the communities that we serve. So thank you for that. I'm wondering if what appears to be, and I could be wrong, and maybe there's a larger presentation that will touch on this, but there seems to be a very strong gender focus on women. But I'm wondering if there are research studies that also note how if the male in the situation that helped create the child and their alcohol history and the alcohol history in their genome is also part of this and therefore should be perhaps a more prominent part as well.
Absolutely. And thank you for asking that. Yes. So, what we do know is that when both partners are sober, there are better outcomes. So, we know that if there is a male partner in the relationship and they are sober, that has a far larger impact on the female partner being sober. We also know from some emerging research, and there's not enough research on it yet because you're spot on. The focus has been solely on the women and solely on prevention. And so the emerging research is showing that there are some structural changes to the sperm that do cause changes to the genes. We just don't know how much yet. But the safest thing is for have a sober couple, have an abstinent household if you are thinking about getting pregnant or you are pregnant. So absolutely, men play a huge role in this too. Great question.
You talked about the first weeks that a woman is pregnant, and in many instances, she probably is unaware that she is. So, you might want to talk a little bit about social drinking as opposed to abuse of that. I don't think.
If I can just restate,
Yes, ma'am.
the question was around social drinking and pregnancy. What we do know is that in a developing fetus, their kidneys aren't developed enough to process alcohol. We also know that alcohol is a teratogen, so it passes directly through the placental barrier directly into the fetus. So the concentration of alcohol, even at social drinking levels, is far higher in the fetus than it is in the adult. And if you think about it, like if you wanted to clean a table or a countertop, right? And you really wanted to change, get rid of bacteria or germs or change cell structures or whatever you wanted to do on there, you'd use alcohol to clean it up. You'd use alcohol to make that change. So, yeah, even at smaller, lower amounts, And there is a genetic component to how people process alcohol, absolutely. But that's why there is no safe time, no safe.
Could you tell us some of, or just give us like some bullet points on some of the symptoms? So like what to look for?
So one of them is driven as though by a motor. So you're talking ADHD, but you're talking more than. You turn around and no word of a lie. One of my kids was peeling pieces out of the wallpaper to climb the wall in the doctor's office. So yeah, extreme hyperactivity. Inability to process multi-step instructions when they're at an age where they should be able to. So for example, my high schooler, I can't say, don't forget to clean up, do the dishes after school, do your homework and, put away your shoes. I have to give those each in one step because her memory, she won't remember it. It's not that she's being defiant. She legitimately won't remember it. So memory issues are a big one. Um, Big meltdowns, big behaviors. One of my kids had a meltdown once that started at 7:30 in the morning, ended at 1:30 in the afternoon. It was sensory issues. She wasn't being a bad kid. She legitimately had something going on with her body, and it just made her out of control. So you can look for sensory issues, you look for things like ADHD-like symptoms, you can look for things like learning deficit and learning disabilities are a big hallmark of people with FASD. But it's asking that question. It comes back to universal screening. If we're asking the questions, then we'll see it. What we've seen is there's no correlation between violence and FASD. And in thought on this, you might occasionally hear about a school shooter with FASD, right? FASD is old and at high prevalence rates in other countries than in the US, if you can imagine that. And there are school shootings by people with FASD in those other countries, right? So there's no correlation there.